sitting for more than 3 hours each day. You can see that about 1 in 5 across the board, a few more in the Philippines, are sitting for a long time each day. So physical inactivity and lack of physical activity is very important in children, particularly in developing countries. And of course, physical inactivity is a major risk factor for overweight and obesity. Now, in 2007, the World Health Organization estimated that 22 million children under the age of 5 years were overweight or obese throughout the world. Now, there are, of course, children who are underweight and malnourished, and that is a concern too, but the proportion who are overweight and obese is increasing. And more than 75% of overweight and obese children live in low and middle income countries. So this is a real problem for developing countries around the world. That's the size of the problem. It's really huge and it's getting bigger. So what's the World Health Organization doing in response to this non-communicable disease problem? Well, this is a very complicated slide, but starting in about 2000, the World Health Organization published the Global Strategy for the Prevention and Control of Non-Communicable Diseases. There was a framework for prevention for tobacco control in 2003, and then the Global Strategy on Diet, Physical Activity and Health was introduced in 2004. Now, since that time, I guess in the last 3 years, the thinking has been that these risk factors might cluster, so that it's probably better to consider them together, physical inactivity, diet and tobacco, in the prevention and control of non-communicable diseases. So in 2007, there's a World Health Organization plan, an action plan for a global strategy coming in about now, and planned to go through to 2013. But I'd like to draw your attention to these two, which are most pertinent to us today. The Global Strategy on Diet, Physical Activity and Health, and the Prevention and Control of Non-Communicable Diseases. Now, the main point of the Non-Communicable Diseases Action Plan, which relates to us, is in Objective 3, which talks about promoting interventions to reduce the main shared modifiable risk factors, which are tobacco use, unhealthy diet, physical inactivity, and the harmful use of alcohol. Now, the third part of this background presentation relates to the Global Strategy on Diet, Physical Activity and Health. This was adopted by the World Health Organization in 2004 and covers all populations: men, women, people with disability, people from different cultural backgrounds, and of course children. Now, the key principles of this strategy are that we can't tackle these problems in a single way. We need multi-sectoral action. This means this is not entirely a health problem. We need to engage with transport and planning and education and other sectors to try and look at ways of increasing physical activity in daily life. Of course, the implementation of the plan will vary very much from country to country and local circumstances. It will vary across age and sex groups and socioeconomic groups. But I think this plan talks a lot about advocacy. We need to keep advocating to governments to invest more in these chronic health problems. And the plan looks at macro level and micro level strategies in combination. And we might come back to some of that in just a minute. So the last part of the talk, and this is where I would like to bring in my colleagues, is looking at key tools for implementing change in relation specifically to physical inactivity. Now, if we start on the left-hand side, this is an overview of an implementation framework at national level. On the left-hand side, we see we need multi-sector leadership. The blue box here points out that we need supportive environments, and that means policies as well as physical and social environments. We need to focus very strongly, of course, on behaviour change, on getting those who are inactive to be active. And we need to work across social, environmental, health and economic strategies. And we need ongoing monitoring and surveillance, which the World Health Organization has started to do. And the idea is if we can get all of this together in an integrated way, we will see these beneficial health outcomes. But that's a complicated slide. I prefer to think about this middle part, behaviour change strategies, looking something like this. Now, this is a model from social ecological models of behaviour change, and it forces us to think about the individual factors which explain why people do what they do, or why they don't do what they do, why they don't do physical activity. It forces us to think about social and cultural environments in which people live, and about the physical and legislative environments which govern the way that people live. Now, by individual factors, I mean things like socioeconomic status, psychological factors such as motivations and attitudes towards physical activity. In social and cultural environments, I like to think about social support and family support for physical activity. And over here on the right-hand side, policy and regulation to promote physical activity. Now, a better way, I think, of looking at this problem is to consider this picture. Now, here, a typical woman from any developed country. She happens to be in Australia, but she could be in Britain and she could be in the US. And the guy at the back is reading the newspaper, which says that new research says that exercise is good for women. And he's telling her, you see, your health problems are caused by a lack of exercise. But in this talk, we're concerned about these children. And I ask you, are these children going to be involved in physical activity? Are they going to be involved in sport for all? And the answer is probably yes, if they go to school, which they clearly do because they're Australian children, so they're wearing a school uniform, and they're going to go to school, and they're probably going to play sport. But are they going to continue to play sport when they leave school with this family environment? Does this mother, who has all of this work, 3, 4 children and a dog, and probably a part-time job as well, is she going to have the time to support these children to be physically active? So this is really what we mean about social environments. Is there somewhere for these children to play? Are there places to be active? Are there policies in school that will encourage physical activity? So just before we go back to that one, there are some policy tools available from the World Health Organization, which Tim asked me to point out to you. There's the framework for monitoring diet and physical activity and health for the global strategy on the left. There's a guide for increasing levels of physical activity in the middle, and a framework for use in changing school policy. And these documents are available from the World Health Organization. So if you need more information, you can go back to those. But what I'd like to do now is to flip back to this woman, or perhaps better, to this slide, and ask my panel members if they can now shed some light on exactly how we can approach behaviour change by looking at these individual, social and environmental factors, by just describing to you some initiatives that they know of that may be happening in their own countries, the sorts of things that we could do to start getting children to be more physically active. So I'd like to start by asking Professor Biddle from Loughborough about individual factors. What sort of things can be done to change individual factors to get children to be more active? Stuart.
Thank you, Wendy. I've been asked to talk about individual factors affecting children's physical activity, and I think one way to do this would just be for me to highlight one or two key issues. Now, if we go to the evidence on what we call the correlates of physical activity, in other words, what is associated with physical activity in young people, we can find quite a lot of individual factors. Now, my first point is, even though I research this area myself, I don't believe that these are the only factors or necessarily the most important. They are part